Chapter 46 Anti-Ulcer Drugs. What is a peptic ulcer? This is an opening, an ulceration in the mucosal lining due to erosions, hypersecretions, or a gastric pH imbalance. Some predisposing factors include things like H. pylori, Helicobacter pylori. This is a specific bacterium that can cause these peptic ulcers. It could also be a result of hypersecretions, mechanical disturbances, genetic influences, as well as environmental influences, in addition to some drugs like NSAIDs that we've already discussed. An esophageal ulcer. These are due to the reflux of acid gastric secretions into the esophagus from an incomplete cardiac sphincter. It could also be a gastric ulcer due to the breakdown of the gastric mucosal barrier, a duodenal ulcer due to the hypersecretion of acid, or stress ulcers due to everything from trauma, burns, or even major surgeries. GERD, gastroesophageal reflux disease. This is an inflammation or erosion of the esophageal mucosa caused by that reflux of gastric acid up into the esophagus. It could have many causes, everything from an incomplete lower esophageal sphincter, also accelerated by smoking, as well as medical treatments like anti-ulcer drugs, H2 blockers, or PPIs. Our non-pharmacologic treatments can include things like stopping smoking, avoiding alcohol, weight loss, avoiding hot, spicy, greasy foods, take NSAIDs and oral glucocorticoids with food, and do not eat before bedtime. They should also wear loose-fitting clothing and elevate the head of the bed wherever possible. Some pharmacologic options for it's going to be tranquilizers, anticholinergics, antacids, H2 blockers, proton pump inhibitors, pepsin inhibitors, or prostaglandin analogs. Tranquilizers. These work by reducing vagal stimulation and decreasing anxiety. While they have minimal effects in preventing and treating ulcers, they're usually utilized in combination with an anticholinergic, with side effects ranging from edema and ataxia on to confusion. Anticholinergics. These decrease acetylcholine by blocking cholinergic receptors and would have side effects ranging from dry mouth, decreased secretions, headache, dizziness, drowsiness, weakness, palpitations, blurred vision, urinary retention, and constipation. Antacids. There's going to be many different forms. Antacids themselves work to neutralize the stomach acid while reducing pepsid activity, and it have side effects and reactions, such as the sodium bicarbonate, which would result in hypernatremia, water retention, metabolic alkalosis, and acid rebound. Calcium carbonate could result in acid rebound, hypercalcemia, on up to Burnet syndrome. Burnet syndrome is a condition characterized by extremely high calcium levels, to the point where it's actually damaging the kidneys. Magnesium hydroxide, resulting in diarrhea, or aluminum hydroxide, resulting in constipation. When giving antacids, we want to evaluate the patient's pain, make sure we're closely checking their renal function, and assessing for any fluid and electrolyte imbalances. We want to avoid administering antacids with any oral drugs because antacids can delay their absorption. We also want to monitor electrolytes, the urinary pH, as well as calcium phosphate levels, and encourage the patient to drink 2 ounces of water after taking an antacid to ensure it reaches the stomach. Histamine blockers. These block H2 receptors of parietal cells within the stomach to reduce gastric acid secretion. They also promote healing of an ulcer by eliminating the cause. Side effects would include things like headaches, dizziness, agitation, erectile dysfunction, and vitamin B12 deficiencies. When giving H2 blockers, we want to closely assess the patient's pain, including type, duration, severity, frequency, and location. We should also advise the patient to avoid smoking and instruct them that the erectile dysfunction is reversible. Alert the patient to any foods and liquids that can cause gastric irritation, and direct the patient to separate any famotidine and iron dosages by at least 1 hour. You should also teach the patient to eat foods high in vitamin B12 to avoid deficiency. Proton pump inhibitors. These directly reduce the gastric acid secretion. They have side effects including things like headache, dizziness, diarrhea, abdominal pain, constipation, B12 deficiency, and hypomagnesemia. Pepsin inhibitors. These combine with protein to form a thick paste covering the ulcer and protecting that ulcer from further acid and pepsid damage. Side effects would include headache, drowsiness, dizziness, dry mouth, constipation, and should be given 1 hour before meals and bedtime. Just like with our others, we need to closely evaluate the patient's pain, as well as assess for any fluid and electrolyte imbalances. Administer the drug on an empty stomach, and increase fluids, dietary bulk, and exercise to prevent constipation. You should also monitor the patient for severe constipation, emphasize stopping smoking, and teach the patient to avoid liquids and foods that can cause gastric irritation. Prostaglandin analogs, these suppress gastric acid secretion and also cause a decrease in pepsid secretion and further protect the mucosa. Side effects would include headache, abdominal pain, nausea, vomiting, flatulence, diarrhea, and constipation. Question 1. Which medication is most likely to be included in a dual drug therapy program for peptic ulcer disease from H. pylori? That be A, omeprazole and clarithromycin, B, tetracycline and metronidazole, C, ranitidine and amoxicillin, or D, ciprofloxacin and sucralfate? That answer is going to be A, omeprazole and clarithromycin. Question 2. A patient with peptic ulcer disease is noted to have a positive breath test for H. pylori. Which of the following would the nurse anticipate as a treatment for this patient? That be A, antacids and narcotics, B, pepsin inhibitors and antiemetics, C, proton pump inhibitors and antibiotics, or D, emetic agents and tranquilizers? That answer is going to be C, proton pump inhibitors and antibiotics. Question 3. An older adult patient reports taking aluminum hydroxide on a daily basis to relieve symptoms of GERD. The nurse needs to evaluate for which condition? That be A, constipation, B, diarrhea, C, flatulence, or D, abdominal pain? That answer is going to be A, constipation. Question 4. When administering a H2 blocker like ranitidine, which of the following is most important for the nurse to do? That be A, monitor laboratory results because ranitidine decreases the effect of oral anticoagulants. B, separate ranitidine and antacid dosage by at least 1 hour if possible. C, teach the patient to avoid foods rich in vitamin B12. Or D, expect a reduction in the patient's pain to occur 5 days after therapy. And that answer will be B, separate the famotidine and iron dosage by at least 1 hour if possible. Question 5. A patient with a gastric ulcer is ordered sucralfate. Which of the following is the action of sucralfate? That be A, calm the patient to reduce acid production, B, block the H2 receptors, C, neutralize the gastric acids, or D, coat the gastric lining? And that answer will be D, coat the gastric lining. Question 6. A patient who complains of gastric disease from aspirin will most likely benefit from the administration of which medication? That be A, misoprostol, B, lansoprazole, C, macrolide, or D, magnesium tricyclate? And that answer will be A, misoprostol. Practice question 7. The patient tells the nurse that he's been treating his stomach pain with a lot of calcium carbonate. Which of the following is most important for the nurse to assess? That be A, Burnett syndrome, B, hypernatremia, C, metabolic alkalosis, or D, acid rebound? That answer is going to be A, Burnett syndrome, which is critically high calcium that can even damage the kidneys. And for our final question, the patient is ordered cimetidine. It's most important for the nurse to teach the patient about what dietary needs. That be A, avoid the use of salt substitutes, B, eat foods rich in vitamin B12, C, eat a high protein diet, or D, avoid citrus foods? And that answer is going to be B, eat foods rich in vitamin B12. But anyway, that's all we got for this chapter. I'll see you in the next slides.